And we are live. Um, Good evening, or it feels like I'm saying good afternoon, right? It's been a long time since we've had daylight and sunshine all at the same time, right?
True. And it's 6 o'clock. So,
Right, and it's six
and
o'clock p.m. and not 12 o'clock noon. So,
yes,
at this point, I ain't expecting nobody to actually be on social media. I'm expecting all of the folks in the world to be outside playing somewhere.
I know that's right because I said the same thing. I walked outside to get walk the dog, and it was such a beautiful day. I had to just take in the air.
Mm. So, good evening. My name is Tony McNeil. I am the host and founder of Anti Black Conversations. And this is our monthly, even though we missed a month last month and then pushed it to this month, this is our monthly COVID conversation. And so I am joined tonight with Miss Mary Davis and Nicole Morris and Vila. Vila, I am not going to not say your last name right, so I'm gonna have you say it when you introduce yourself. Say again.
Vila Lemuel.
Vila Lemuel. And so tonight we're going to be having just a very brief but interesting conversation to raise awareness around, well, not even raise awareness. We just want to chop it up tonight. How about that? We're going to chop it up tonight. But the COVID conversations, basically, our hashtag is WTF. What's the facts around COVID? And so we've been doing this for the better part of, gosh, now a year and a half. Um,
Yep.
bringing just the updates and stuff around COVID. And so, I mean, as of now, we're out of a state of emergency, right, Aaron?
As of last month, February 28th for California.
Yeah. So we're not in a state of emergency anymore. So, just kind of real quick then, even with that. Well, let's do this real quick. Mary, Nicole, Vila, introduce yourselves. Mary.
Yes, thank you so much. Hello, everyone. Mary Davis. I'm with Public Health Advocates, and I am the program specialist for the Reach COVID Flu Grant. I'll go ahead and pass it on to Nicole.
Hi, everyone. My name is Nicole McMorris. I'm also on the Reach COVID Flu Grant with Public Health Advocates. I'm also with the Neighborhood Change for Champions as well with Reach COVID, or excuse me, with Public Health Advocates. And I'll popcorn it over to Vila.
Hello, my name is Vila Lemuel. I've been in the healthcare industry for 20 years. I've been a registered nurse for the last 12 years, and I'm an ER nurse. Excuse me. I worked through the pandemic and still currently working as a ER nurse.
Mhm.
And Vila, I wanted to thank you for joining us by phone. So Vila joined us from her mobile device. She's on vacation, but she works a lot, and so just was able to hop on with her for this conversation. So thank you, Vila, for just hopping on from your mobile phone.
Thank you for inviting me.
So tonight we are going to flip it a little bit, and I'm going to be the guest, and Mary is going to be the guest host, because tonight we are going to talk about the current state of our healthcare. And I figured instead of bringing in some unsuspecting person to have this conversation, yeah, I get to be the case study this evening. So
Yes,
I'm excited.
and we're all excited. We want to hear about your experience and we want to know what's going on out in the healthcare facilities and in the healthcare world. So, thank you again, Bila, for joining us because I know your point of view and your aspect of everything is going to really tie all of this together. So, Elder Tony, I understand you recently had a emergency where you needed to go to the ER.
Yes, ma'am, I did. I called 911 and everything, which is not the norm for your sister. I got control issues, y'all. So if I can't drive myself there, it ain't happening.
So you went
Um,
in by ambulance.
oh, yeah, I called the paramedics. I dialed 911. I was having extreme pain, and I was trying to ride it out in order to see if I could just get to my doctor. I'm throwing everybody under the bus tonight. So I have Kaiser, and so I was waiting to see if I could get to Kaiser in the morning. But in the middle of the night, the pain was so bad, you guys, that I was nauseated every time I breathed in. I couldn't stand up straight. I felt like I was going to pass out or collapse. Um, and it just kept getting worse and worse and worse, just waves and waves of pain, sweating. I couldn't, so I called my neighbor
Mhm.
um,
Mhm.
next door because we, just have a system in the event that there's an emergency. So I called my neighbor and let her in and dialed 911 and called for the paramedics. My children were out of town.
Okay, okay. So when they came, when they came, because how long did it take them to get there?
It didn't take them any time to get here, but that's because I don't live in a hot spot. And so, but we're not going to go there. That's a different conversation.
Hmm.
Nicole, I'm trying to stay on the right side of the fence. So
Hi.
because I don't live in a marginalized area, it took them
Hmm.
no time to arrive. However, when they did arrive, and so I was nervous already, Vila, because it was in December when I was calling them. And so in December, early December, we were dealing with a high volume that we were rising. Our COVID cases were
Hmm.
rising in
Hmm.
December. RSV was like higher than the COVID cases, if I'm not
Hmm.
mistaken, in December. Flu,
It
so
was
I mean, it was
definitely
like,
on the rise.
it was all of that. And
We were in the
so,
red.
yeah. So I called them, and when they came, um, my first, I was really already nervous, but I could not, I couldn't think straight, you guys. And I keep masks, right, all over the place, but I couldn't even, Nicole, I couldn't get my mind even
Think where
to
they
say
were.
where they were.
Hmm.
Right. I was like, and I was trying to let my neighbor know where they were, but I couldn't even think. And I thought that they would just give me one, but they didn't. And none of them, there were, I think there were three gentlemen that came in, and none of them had on masks.
So when they got you to the hospital, were you able to be seen? How long did it take you to be seen? What did it look like? What hospital did you go to? Because that's another thing we want to know. What this looks like.
Right. So, so I was already nervous about having to go to in which hospital, but because I am a Kaiser patient in Stockton, I only had one option, and that was St. Joseph's Hospital.
Mhm.
And so the rumor is don't go to St. Joseph's. I'm not telling y'all not to. I'm just saying that's like the rumor, right? It's just
Mhm.
don't go. It's changed. And but I was in so much pain, I didn't know if I would make it to another hospital, and I couldn't think which hospital should I go to as a Kaiser patient. So we ended up going to St. Joe's, and when they got me there, they were trying to find a room for me, but they didn't have any rooms for me. And so they kept me on the bed for a moment, and then they took me further down into the hallway, into another area that had been converted into these like cubby like spaces where there was just chairs lined along the walls,
Mm.
um, and in different areas and stuff. And so it's been transformed a lot. I haven't been there in quite in years. Um, and so they helped me off of the bed, put me in one of the chairs, um, and um, and they left. And so I sat there. They did put a band on my arm before they took me off of the bed, but I sat there for the better part of an hour or so before someone actually came and seen me.
And this is coming in from an ambulance
Hmm. Hmm.
in the
Yeah,
hallway.
this was coming in from the ambulance. They kept, they were trying to see, and I was thinking maybe I was going into, maybe it was a triage that they were taking me to. That's what I was thinking, that they
Mm.
were taking me to triage. And so I was thinking I'm waiting for them to come and to check to, my temperature and all of this different stuff, but none of that happened. While I was there, I got a text message. And the text message, y'all, I've been in my feelings a lot lately. So if I get in my
Mm,
feelings, just know I'm gonna be all right.
mm.
Um, I got a text
You
message, and
good.
the the text message was telling me that that was being seen, and that these tests were being run, but nobody had seen me yet.
No,
So
they would put in the chat that you were in Area 39. What is Area 39, Vila?
So
Dude.
I've been a travel nurse, and I've literally worked in every hospital in Stockton, as well as many of them in the Bay Area. And the what you described sounds like what we call Area 39. Um, so, um, not being a devil's advocate, but being in emergency medicine, COVID has drastically impacted healthcare in so many ways, from healthcare professionals committing suicide, from PTSD, to nurses retiring, nurses passing away. So there is a severe healthcare shortage right now. Not to say it's okay to treat patients in any kind of way, but I'm gonna be honest with you. If you are coming in, whether ambulance or walking through the front door, if you don't have vital signs that saying that you're gonna die in the next hour or two, unfortunately, that's kind of how things go. Unless that emergency room has a different system put in place where nurses work almost independently, in the sense of doctors kind of see a triage, they see vital signs, and they put in orders for you. And then the nurse kind of just goes in and draws blood and does everything based on your symptoms. You may not even see a person, but the fact that you sat there for an hour plus and did not see anybody concerns me. You should at least seen a CNA, MA, LVN, ER tech, somebody. But I can say, um, St. Joe's has been having a hard time retaining staff.
Mm,
That's probably been one of the main, Stockton in general. So let me
Mhm.
say, Stockton has had a huge influx of Bay Area population.
mhm,
We have probably one of the biggest, highest crime rates in California. So the number of patients that San Joaquin County sees as far as trauma, the number of patients that St. Joe sees. St. Joe's is our cardiac hospital in Stockton. So they
Mhm.
see all cardiac patients, and even in any that comes through San Joaquin General, they're shipped to St. Joseph's.
mm,
In all honesty, Stockton needs another hospital.
Mm.
Dameron is currently, I believe they were taken over by St. Joseph's Dignity Health,
Mhm.
and they're in the process of trying to grow and reestablish and see patients. But right now, Stockton is really, and I'm very surprised they haven't been on the news, but I receive a lot of emails from different staffing agencies asking to staff these hospitals.
Mm.
mm,
So a lot of times, in majority of cases, they are probably staffed with 40%, maybe even 30% of their
Mm.
home staff, meaning these are nurses who are employed by this hospital. And everyone else is typically traveling nurses. I can't speak to the providers because nurses outnumber the providers all the time. And I say
Yeah.
this always, and many healthcare providers who have worked through the pandemic understand nurses are the heart of healthcare.
Yes, they are.
Um,
Yeah.
so if you have majority of your staff traveling nurses, they're not even familiar with this hospital. They're only there temporarily.
mm,
And a lot of times, a lot of them don't feel comfortable taking the initiative to work independently and have the autonomy to make independent decisions, because if management or whomever disagrees with what they've done, they can be
Mhm.
easily fired. They're not supported by a union or anyone else.
My goodness.
But they do, and it's very sad. The wages that these hospitals provide are not comparable to Bay Area hospitals. So, and a lot of times, you know what I mean, being a nurse who worked through the pandemic, being a nurse who lost family to COVID, uh, you are literally putting your life on the line. COVID has literally taught us you are putting your life on the line every single day that you go to work. So, in all honesty, why work in a environment where you're not appreciated, where you're not valued?
Mm.
Which is one of the reasons why these two particular hospitals cannot retain staff. And this is
Mm.
not to say anything negative about the management, because in all honesty, I'm not sure what management is there at this time.
Right.
Mm.
But it
You
takes
know, I
a very, very powerful healthcare leader to come in and change the culture.
my God.
And
Mm.
not only that, a very powerful healthcare leader to come in and pull in resources that they need to truly give the citizens in their area the care that they deserve. And
Mhm.
as of right now, it's I wouldn't say it's impossible, but it is very hard when you don't have the bodies to do so.
Right.
When you
Mm.
don't
And
have
that's what I've
the
seen, Vila.
seasoned, right, seasoned nurses to go
Hmm.
in and create a culture to where these newer nurses know what they're doing.
I had two. So there were two nurses, or I don't know, nurse tech. Um, a total that night that I seen were three. A total that night that I seen were three. The space, so we're gonna call this area 39. So my area 39 space that I was in, there was an average easy when I first came in of about 30, and for sure before I left, 40 plus individuals. Um, the baby that was in the mama's arms that was in the cubby that was right next to me, while I was waiting, I found out as they were talking that the baby had RSV.
Mm.
Two cubbies down or two chairs down. One of the patients that was sitting two chairs down from me tested positive for COVID. Um, there was somebody that was across from me that had been in an accident, and then there were some people that were suffering mental breaks. There were people that were displaced, and in one of the rooms that was right around the corner from me, there was a patient who had been shot, and he was being questioned by PD. Everybody could hear the questioning and the answers and everything going on. Found out that it was in the county jurisdiction. SPD left. Sheriffs came in, and so and continued the questioning or what have you. He shouldn't even been there technically, because any type of gunshot should have been transferred over to, I think, the San Joaquin County Hospital.
Correct.
So all that being said, I seen a doctor one time, and that was like 4.5 to 5 hours in. So where I do want to go is the nurses. So the one nurse think I was in so much pain. I was hiccup crying like a baby. I was so embarrassed with myself, but it was also very scary because of my so I have an irregular heart rhythm, but I know that it didn't feel like that. And I have had back issues, but it wasn't my back. And
Mhm.
so the only thing that came to mind is that earlier this year, they said that I was passing kidney stones. And so I wasn't sure. I've had gallstones before. That was several years back, but this was the only thing that it kept feel like. So I wasn't sure. Maybe I'm passing stones. Short is they ended up taking me in. They had me walk from one side of the ER in the back to another side. And the I could barely walk. The technician that came and got me, all she could do was just apologize by the time I got there, for having me walk that far and make sure that I knew I would get a chair to go back, and they wheeled me back. So they did the CT. While I'm still sitting and I'm waiting, double masked up at this time, I asked them to give me another mask. They asked me to do give them a urine sample. I go into the bathroom. I went to close the door, but there was blood on the door. where someone had smeared it with blood with their hand. There were caps, those things, that you sit inside the toilet to catch the urine, sitting on the floor next to the actual commode. And then there were, urine paper that had been sitting on it that was on the floor. So I asked them if they could give me, the nurse, if they could give me some sanitary wipes so that I could just wipe things down. The nurse came in, saw it, and said, "That's okay, ma'am. Just go to this one over here." So I went to the next bathroom. It wasn't as bad, but it was pretty bad and very unsanitary. So I went ahead with the sink. I wiped everything down so that I could give them a urine sample, and went and sat back in my seat. So I mean, they gave me wrong. They gave me the wrong test results. So I mean, things were really bad. If it weren't for the two nurses, there were two nurses. The one nurse that helped me, and then there was another nurse, and I don't even know their names. Um, but these nurses answered everybody's question. Every time somebody said nurse, nurse, they stopped, they responded. And I wasn't one of them saying nurse, nurse, or what have you, because I recognized that, that what's going on. And I was trying not to be irate, and just like other people were, that they were responding to. There was one nurse that was helping a man, and he was just as quiet as I was, but he was absolutely in pain too. But he didn't speak English, and she did. So she was translating for him. So the two nurses that were there, I really thank God for them, and the way that they engaged. That nurse, seeing how much pain I was in, she ensured that I got a shot. There's addiction that runs in my family. I'm very, very nervous about medications. Um, so she assured me, that it wasn't something that, that was like a narcotic or what have you. But at the end of it, Vila, they said it's not you. There's no stones. You're just having muscle spasms in your back. I wasn't. It wasn't. They gave me medication for pain, and sent me home. I went to my doctor the very next morning. I emailed him first thing in the morning. He called, and I was able to go in, and I did a camera visit with him. And he sent me in to do lab work late that morning. He did lab work all under the thing. Them people told me I had stuff that I was like scared to death, y'all. So my doctor tested me for everything that you could think to be tested for under the sun. They drew all kind of blood, all kind of stuff. Come to find out, I had a kidney stone lodged in my urethra. Um, and so that's why I was in so much pain, because it was stuck. So I was passing kidney stones. A test, showed them that. Um, and some of the test results that they gave me were not accurate.
So going to the hospital didn't really help you.
No, it did give me a
You
nice bill.
It did give you a nice bill though. So,
Yeah.
and I wanted to kind of go back to what Vila was saying when she was talking about what the causes are for the experience that you had at
Yeah.
at the ER. The high crime rate, right? The increase in healthcare needs due to the high crime rate, and then the management over at the hospitals. They are understaffed and they don't have a lot of
Support.
skilled, is it support and skilled upper management.
No, it's more so nurses who are home nurses. So let's imagine like you work, you guys work for public health advocates. So let's say for the next 3 months, you guys are pulled to a different department just to fill in temporarily. You're gonna
Mhm.
go into this new agency and think, okay, well, tell me what you need me to do.
Mm.
You know,
Mhm.
who does what? What are these? What are these different staff's names? So just imagine being a nurse in those situations. It takes a very strong nurse. You have to be a seasoned nurse to go into a new ER
Mm.
department and kind of demand from a doctor, I need pain medicine from this for this patient right now.
And especially these particular ER departments, right? In this area, in the
Yeah,
Stockton area, because a lot of
there's such
people,
a demand on the doctors. It's just a lot of demand on everyone. But I can say, being a seasoned nurse myself and being a traveling nurse, I know personally that when you have patients come in severe pain is actually considered a high acuity, despite whether or not your vital signs are okay. Having severe pain actually increases what they call an ESI level.
Oh, and my blood pressure, Vila, my blood
Hmm.
pressure was through the roof.
Yeah. So whatever, and it's very sad to even hear this. But I'm gonna tell you just on live in general. Mary, you can give her my personal number. If you ever
Mhm.
have any issues going to a Stockton hospital and you're not attended to in a timely fashion, you can definitely call me.
Call Vila.
Yeah, I'll definitely make a call to the charge nurse
Yes.
to bring attention to the situation. I can say I can say personally when I brought things to charge nurses' attention,
Mm-hmm.
it's taken seriously and it's addressed. So, and I can say this: whenever you have any family member in the ER or any hospital, make sure your presence is known. Make sure you ask questions. Make sure those healthcare staff know someone is looking after you,
Mhm.
because then their
Mm.
behavior is different in how they address you. And it's
Mhm.
sad to say, and I'm not saying that's your situation specifically, but I do know
Right.
the healthcare industry is under severe stress right now. We have a lot of new grads in our different departments. These nurses are trying to figure it out. You know what I mean? And they're
Yeah.
intimidated by doctors at times. So we really do need the presence of seasoned nurses. We need the presence of strong management, and we also need to reevaluate the population of which we're seeing now, the numbers, and also the strategy of which they triage and see patients. I have seen a lot of hospitals re-strategize after COVID, and also looking at the RSV and COVID situations. I can say that many hospitals are very lax on the isolation criteria that once was in place for COVID patients.
Mhm.
That it's very laxed now,
Mhm.
very laxed.
Even when you brought up the fact that they didn't have a mask for you, that
Correct.
would
Mm-hmm.
not have occurred last year, just 1 year ago.
Right. Right.
Yep.
There is talk of a no mask put in place in hospitals now. Like where healthcare staff are not required to if they don't want to. Uh,
Mm.
Wow.
Me personally, I wear a mask probably forever for the rest of my career. But there are some
Right.
healthcare professionals are kind of tired of wearing masks. But
Mhm.
there's different strains. I personally feel like COVID is going nowhere. There's just different variants coming out. COVID is just another influenza. In
Mhm.
Right.
my opinion, okay, this is not something that's scientifically found or anything. This is just me
Mhm.
being here and seeing how things change. Um, Elder Turley, I don't, in all honesty, unless you were to go to a smaller hospital that does not see as many patients, your care
Mm-hmm.
likely would have been different. To be honest with you,
What
maybe
about
like
Yeah.
Lodi?
Antigua Kaiser, no,
Mhm.
that is just as bad. But
Wow. And then,
yeah,
because you know that was the next one.
Lodi Memorial sees a high number of patients. Any ER,
Mm.
and they also have retention issues. I've also worked
Mm.
there as a traveling
Mm.
nurse. Uh,
Man.
but Manteca Kaiser ER, I'm not sure
Mm.
why they take you there because Manteca
Mm.
has a ER. Kaiser does anyway.
Mm-hmm.
They're much smaller, um, but I personally feel like the care probably would have been different.
Yeah.
Yeah. Well, it was this was scary. It was definitely eye opening, and it let me know that things have changed. I don't see my doctor in person. I can, but he's been my
Mhm.
doctor for many years. But at this point now, as I was just interviewing and talking to different people, leading up to this particular conversation this evening, most people they don't have the same even personal, in person care that
Mhm.
they used to have with their primary physicians anymore.
And I think that goes into what Vila was saying when they are also, it's convenient for them, right? And then they're also sometimes, I guess, afraid and scared for their life to see these patients live in person.
Well, I know that and I know that my doctor, that does frustrate him to some degree. He feels that things have definitely changed, and that people are still being billed and charged, and but now for impersonal services that are um, that just are so vastly different.
Yeah, and I
So
think that should definitely be reevaluated and assessed, because I should not be getting charged $1,000 if I don't get to talk to you in person.
girl, look, it's a whole, like I said, it's a thing right now. Let's just know it's a thing.
Mhm.
But I mean that's pretty much the gist of tonight's conversation, is that healthcare has drastically changed. And so I'm glad that Vila was able to hop on, because um
She broke that
I mean,
down.
what can we do? How do we as the community, how do we advocate? What do we do? Who do we even talk to about things
Mhm.
like this? Or is do should we expect it to be this way and just get worse?
I'm gonna be honest with you. Uh, we really need our politicians to get involved at this point. We need more hospitals built. We need more new grad programs. A lot of hospitals are not even willing to hire new grad nurses. We need more resources for our physicians. We need something um, that will draw them in to our hospitals. In all honesty, like if you sit and think about where you want to work, do you want to work in a high stress environment? Do you want to work where you're short staffed? Do you want to work? So they have to resolve issues that they have, but they need the resources to do so. You can't fix a Stockton problem by hiring out of state nurses for 3 and 6 months at a time. You know
Mhm.
what I mean?
Yeah.
You can't. They also have traveling physician assistants and physicians. They're trying to fix it, but they already know it's a temporary fix.
Mhm.
They're just trying to get what they need done. They need patients seen and treated. So if you
Mhm.
a doctor to come in and there's no one in the Stockton area willing to work there, and if they are willing to work there, they're only willing to work there once a month. You know what I mean? That's not helping. You can talk to whoever you want to. It's up to the staff that's physically working there day to day that's going to resolve these issues. I personally feel like just being a nurse working in these departments, there's no politician that's going to come in and tell me how to do my job. You know what I mean? Unless you're giving me the help that I need to do my job correctly, you cannot tell me how I need to prioritize my patients. If I have 4 patients and they're all in pain, I have to prioritize one over the other.
Mhm.
That's a situation that these healthcare staff are put in, is that they're having to pick and choose, just like in COVID. They had to literally pick and choose who received a ventilator and who did not. We have to really go back to the thinking that had to change for healthcare staff. We're taught to save everybody. But at a certain period of time, less than 3 years ago, we literally had to choose who died and who didn't. You know what I mean? So our physicians are under a lot of stress. Our new doctors are under a lot of stress. These residents, Stockton really needs not only a new hospital to kind of shuffle some of these patients too, to relieve the stress off of the county and St. Joseph's, because they're seeing a high number of patients that they
Mhm.
truly cannot handle. You going into the ER was one thing, but think about all the patients that physically left because it was taking too long to be seen.
Oh, you're on mute. You're on mute.
I almost did. I promise you. But
Yeah,
guess why I didn't?
because you
I
was a
didn't drive.
He was waiting for
That's the reason why I don't never go nowhere without driving my own car. Never off to go nowhere. My children were out. That was the other thing, you guys, that was so scary for me. My children were out of state.
Mhm.
So I thank God for my best friend, Thomas. She got up and came to the hospital. They wouldn't let her in. But she made her presence known, and things did change then because
Mhm.
not on. I mean, she cut up in the lobby, all of that, and so she had me on the camera thing. She brought a blanket for me because I was freezing. I was literally shivering. And then brought me water and cranberry, and so the security guy came in. He was like, Miss McNeil, Miss Mc. Okay, your sister is here, and she said she's in the car, and she would not leave.
That's
So I
Right.
thank God for her. I thank God for that. So you were right about that, Vila. Having
Mhm.
somebody there with you, it makes a difference.
oh, absolutely, yeah. Let
Ooh, it makes a
every
difference.
family member need to make their presence known for any patient that's in the hospital. Not to
Mhm.
say that healthcare staff will ignore you. And even being a nurse myself, when I know there's family that's out in the lobby in distress, concerned about their loved one, you gonna make contact with them. Not that
Right.
you
Mm-hmm.
it's not in a sense of, oh, you're more important because you have family in the lobby. I now have two patients. I now have the patient and their family now.
Mm.
You know,
Mhm.
so there's a lot that goes into just caring for a patient. When it,
Mm-hmm.
when their family is involved, you now have to ease their family concerns as well as the patient. Where
Mhm.
everyone now feels like their loved one is going to be taken care of. You know what I mean? So it is a lot. But as a nurse and as a family member who've had patients in the hospital, I don't have. So, Elder Tony, when you have family members out of town like that, Mary, I'm very serious. Give her my phone number.
Mhm. Oh, I'm gonna send you her phone number. Call
Because
Vila because she will definitely
Ah,
get on
yeah.
their butts.
a lot of friends and family and stock, they will make a call to me when they're in situations such as that. And
This
then
is
all it
crazy.
takes is a very concerning call where we're speaking the same language. When you start saying
Mhm.
medical
Mhm.
Mm.
terms of the same language, they then know
Oh, she
they,
know what she's
they,
talking about.
they need to handle their business. Exactly. Because you can
Mhm.
request your medical record. You can request it. That is your
Mm-hmm.
legal right to. And you
Mm.
can trace the date and times when you came into the ER, when you first got your medication, when you got a CT scan. You can
Mm-hmm.
show what time things happen.
Mm-hmm.
And of course, hospitals don't want that.
Wow.
Mhm.
And it's not a threat, but it's something that needs to be highlighted that our healthcare industry needs help.
Mhm.
It does. It does in a very big way. It really, really does in a very big way. I know that I'm extremely grateful. They did call me, but I'm grateful for my doctor. I'm so
Mhm.
grateful for my doctor. I thank God for him and all of that. So they now, and mind you, when I say like Vila, they didn't tell me I was diagnosed with hepatitis C. They said that they thought I had some strain of it of some sort.
The doctor said that.
The
That's
app said it.
The what? I'm sorry.
The app. I told you they weren't talking to me. They gave me an app.
An app.
she got
They gave,
notification basically as she's sitting there, haven't got any results. She was getting updates that her results were possible hep C, but
What?
she
yep,
hadn't been
yep.
tested or
Vila.
anything. You're getting wrong
Ooh, I'm
information.
laughing now.
I would be terrified. I would
Gila,
be.
I'm laughing now, but I promise you, when I was talking to Mary and Nicole about this, I was in tears.
Man.
I
Wow.
was I was terrified. I'm like, okay, well, wait, what does this mean? Wait, I don't
Wait,
understand.
but whose results was coming to you?
I
Somebody,
don't know.
somebody with the
So
P.
in all honesty, like this, I really feel strongly that you should let St. Joe's administration know about this situation
I
because
did. They
not
called me.
oh good, okay,
They called
because
me.
that's
They
a HIPAA
called me to
violation.
follow up with me.
Yeah,
My
there's a
doctor
lot
was
of violations in the story that I heard because you heard every conversation about 4 or 5 patients. What was
yes.
going on, and those are all
Oh,
HIPAA violations.
all of them that were around me. So everybody, everything. I heard all of the. So we're talking HIPAA violations, the investigation of the shooting of the individual, and the way that he was being treated, and even the side conversations by the sheriff, and the sheriff's department and the officers, based on the things that he was saying. So we got all of that information. But like I said, the text messages that we're getting, so the lab work that they were sending me was giving me information, but it wasn't accurate information. And so my doctor, he kept saying, he's an African doctor, Tony, Tony, but he's known me forever. So he's Tony, no, just it's okay. I want you to come in. He says we're going to do very thorough testing for everything. I'm going to have them do blood tests for you for everything. He tested me for any and everything that we could even possibly imagine. I was getting test results from Kaiser for 2 weeks, y'all.
Mm.
For 2 weeks. And then he was calling and just going over everything with me. He was like, see, he said, no hep C, no hep B, no, you have no viruses, no infections, no,
Mm.
you're good. And then he said, but you were passing a kidney stone. And the specialist let me know that the reason I was in so much pain is because it took 48 hours for the stone to pass. If not, they were going to bring me in order to do some kind of something to see if they could break it.
Mm.
Um,
Wow.
and he gave me, and so I had and because I had surgery last year, I still had oxycodone.
Mm-hmm.
Um, and so, because that's the only thing that got me through the night and the next day. And so the doctor, my doctor then gave me a schedule because he knows, my fear of addiction to medication because of my family history. Um, and because I was in so much pain, he was like, we got to deal with it. You're gonna have to have something for pain to rest. But that's why we had such a strict time regimen on it. But yeah,
I have
sis,
a
it's really
question.
bad.
When
Huh?
St. Joseph, I have a question. When St. Joseph discharged you, did they discharge you with any pain medication?
Yeah. Well, no, they didn't. They discharged me with muscle relaxers, a prescription for muscle relaxers that I couldn't go and get filled because um, I, I couldn't stand up.
So another question. Your CT scan, your doctor did not redo that scan, correct?
He didn't. No. No, they
Okay.
did a ultrasound.
They did an ultrasound. Okay.
And they did the ultrasound based on my urinalysis because my urinalysis came back very cloudy. The specialist wanted to have a closer look.
Specialist meaning urologist?
I guess.
Okay. I'm sorry. I'm
Girl,
just
look, I don't know today.
I'm just I'm just asking because
It's
I
the
we see a
specialist that
lot
I
of
had.
patients. with kidney stones, and typically that stone is identified on the CT scan. So I'm
No.
curious so your CT scan results on your kp.org did not say anything about a stone.
No,
I
I
know
didn't
this
do
is
a C.
a long time ago for you to recall.
Oh,
Uh,
you talk no. So on my kp.org, you mean they're accessing the records from St. Joseph's?
Sometimes it goes to your KP. Um, well, actually, Kaiser can request it,
Right.
but
So I
seeing
don't
that
know.
CT result would have been, well. Hopefully, St. Joseph administration looked into that, because typically stones are seen on CT scans unless it's already completely has passed.
Yeah.
So
So
Mm.
I don't know,
so
that
no.
that's a very unfortunate situation, and I really hope that your story gets St. Joseph's jump started on some changes.
Yes, definitely. I agree.
Well, so we know that we are going to need to talk to our officials in order for them to be able to make some changes, and maybe we need to, Mary and Nicole, just have some more conversations and do a little bit more research in order to have those conversations.
Definitely. And I think that that's something that we need to bring to light, especially with our political officials, talking about our healthcare facilities, where they're at right now and how we can improve them. So I wrote a few things down. And again, I want to say thank you, Vila, for coming on and dropping them gems and really letting us know what to expect and how to deal with these types of issues. And then also just informing us of the impacts and the losses that you guys have taken as healthcare providers. Again, thank you for doing everything that you do. We appreciate you so much. And thank you so much, Elder Tony, for sharing your story, because I know that that was hard. And I know that that experience was traumatizing. And again, our hearts go out to you, because I could not even have imagined. I would have been on the phone with Vila.
Right.
Uh,
Definitely.
If
Elder,
ever again.
Elder Tony, one thing I do want to say is that these kind of experiences does prevent many people from even wanting to go back to a
Oh
hospital.
Mhm.
yeah, that's what I
Definitely.
was gonna say, Vila.
So
Yeah,
Ever
Mary says,
again.
Mhm.
yeah,
I've
so
heard
I
yeah.
too many
please, please,
stories.
please do not allow this experience to prevent you from to prevent you from getting help that you need. Because
I
in all
hear.
honesty, you can tell the paramedics, I want to go to this hospital,
Yes.
and they have to take you there. Unless you're literally dying, they have to take you to the hospital you say you want to go to. I don't care what your insurance says. It is
Hmm.
an intolerable violation to refuse to give you care based on your insurance. So, Kaiser patient or not, you can go to any ER that you need to if it's an emergency. And Kaiser's going to pay that bill because that's what they have to do.
Mm.
Wow. Well,
See,
Yeah.
that's
So
good.
just,
another gem.
I know
yeah,
that one
that's, let me
because
just,
I've had
yeah,
that
they
experience.
cannot tell you unless you're dying. No, seriously, unless you are dying, they have to go to the nearest hospital. That's what paramedics have to do.
Right.
But you could have, they could have took the 10-minute drive to Kaiser Manteca. But again, call me, but please don't hesitate to go get emergency care, because again, with being women, um, our
Hmm.
signs and symptoms of heart attack is much different. Stroke signs and symptoms, you only got 4 hour window to get some help. You know what I
Yeah.
mean? So it's very time sensitive when it comes to needing emergency care. So don't let this traumatizing experience prevent you from getting the care that you need. If you need, call me. Like I'm very serious about that. I don't
I
care what
just
time
sent
of
her
day
your
it is.
number.
I'm very serious. Call me, and I'll make the phone calls that I need to. I may or may not know the nurses that's in the building at the time, but I will talk to a charge nurse and explain my concerns and situations. And if my herd needs are not being met, I will physically show my face.
Amen. And I appreciate that, and I appreciate you for that. I've got your information. And I do. I hear and receive what you are saying, because that's the override is that, yeah, if what I did leave, and I'm glad you said that, because what I did leave with and what I have heard many people have left with is I'm never going back.
Hmm.
I will never do that again. I've had individuals sent home that were having a stroke, as of recent. Um,
Hmm.
so yeah, that's we're gonna need to do something, y'all. We got to do something. We can't.
We'll
It
do
can't stay.
another.
All right, y'all. Well, there's another COVID conversation, sobering as it is. Um, the pandemic is over, right? Or the state of emergency is over, but COVID ain't going nowhere.
It's gonna
So
be
wear
for a
your
while.
mask, wash your hands, you know, do what you need to do. Use your test at home. And at this point now, from what I'm understanding, um, go ahead, do your the test to treat sites that
Mhm.
they have that they post.
Take advantage of the test to treat
Yeah,
sites.
Because if we don't use them, we will lose them, especially
Definitely.
with the state of
I'm sorry.
emergency being.
Can you guys elaborate on test to treat? I haven't even heard about that.
Test to Treat is a site that you can go to. I believe there's two in Stockton, Hazelton Clinic, and one at the county hospital, where you can get treatment, medication for COVID-19. So you can leave with the pill on hand. You don't have to worry about going to a
Urgent
pharmacy
care,
to
right?
pick up your prescription. If you test positive at that site, they will treat you there.
Oh, okay.
So it saves the ER a lot of visits.
Yeah.
Yeah.
Kaiser, a remdesivir clinics, infusions, and different things like that for their COVID patients.
So do they have test to treat sites as well?
I'm assuming it falls into the similar category that
Mhm.
they one like almost like like remdesivir is an IV infusion. It's not necessarily a pill. When we
So
do
it's not the pill, it's
it's
the
a IV
IV.
infusion. Yeah, it's for more
Mm.
higher patients. Um,
Oh, okay.
Basically,
I've
ER was typically the location of which we did that, so it is kind of
similar.
taking a workload of the ER, but a lot of our pharmacies give that when we have a COVID positive patient. It's kind of just like an outpatient pill that they give them. So,
Oh, okay. Gotcha. All right.
All right, ladies. Well, I love and appreciate you. And we will tap in with you all next month for another COVID conversation. Is there any announcements that you all have, Nicole or Mary, from PHA?
I know we do have a vaccine clinic this Sunday at Life City Church. You guys come out if you need your vaccine. There will be COVID-19 vaccines available, and anyone who is vaccinated will receive a $50 gift card. So come on out. We'll be at Life City Church from 11 to 3 on Sunday, March 19th.
And then
Can I get my third? I think the second what
You can
third?
get your bivalent. Yes, if you have not received your bivalent booster, yes,
please
come
come out.
out and get it.
And I'll get a gift card.
Yes, and you receive a gift card. Yes, ma'am.
And then
I'll be there.
I know
Okay.
that's right.
also, Elder Tony, next month I will be hosting our spring into health event in Tracy at 1005 East Pescadero at the Tracy Northgate outlet. So we will be having free vaccines, we'll have free food, we'll have entertainment, have a live band. We will also have games and activities for the kids. So that's another opportunity for folks to come out and join us for a family day. And also be able to have some good health community resources there as well. So
Yes.
Definitely. And you'll be able to get your vaccine there as well and receive a gift card.
yes,
All right. So we got stuff that is coming up, y'all. Tap in, inbox me, hit up Mary at Public Health Advocates. MD.
Yes, at public health phadvocates.org.
phadvocates.org. I'm always struggling to put that in there. phadvocates.org. Bam. If you guys need to get in touch with Miss Mary, go ahead and hit her up. She'll connect you with everybody else.
Yes, definitely.
Save my typing fingers. I need to get my nails done, y'all. They're too long. All right, you guys. Vila, I appreciate you, sis, so much. Enjoy your vacation because you need it.
Yes. She's in Puerto Rico right now, so have fun for us, Vila.
Oh, for real? I'm so glad you tapped in. Thank you. So
Yes.
for those of you that watch this, share this information. Go ahead, sis.
I said I'm all about self-care, all about it. After COVID, it taught me very well I don't take care of myself good enough. So
that's
all
right.
I'm doing from this point on. I do want to commend Mary and Nicole on doing such an amazing job with reaching out to the community. I have attended a few of their events, and it's amazing the turnout and the different walks of life that come into the building to kind of see and learn what's going on and to get the resources. I commend you, Elder Tony, for being a role model and advocate for all. Like, we appreciate what you guys do, and everyone's gifts and blessings. I see it coming together and reaching a lot of lives. So I really appreciate you guys for what you do.
Yes.
Thank you so much.
Thank you so much.
All right, everybody, you have a wonderful evening. Ladies, you guys have a wonderful evening. Be safe, wear your mask, wash your hands, do all of the stuff you need to do. If you think you got COVID, stay home. I don't want it. All right.
All right. All right, guys. You all have a good night.
Have a good one.
Thank you. Bye-bye.
Bye.
Bye.